All right. I want to be respectful of your time, so we will go ahead and get started. Man, are we thrilled to have you guys here today for the webinar of revenue, COGS, and labor. Oh my, such an amazing turnout today. So it's clear that these topics matter to you as much as they do to us, which is fantastic. At Granite Peak, we are incredibly proud of our bookkeeping division, which we have built, continue to grow. Unlike many other bookkeeping firms out there, we don't outsource overseas or rely on AI to handle your numbers. Instead, our entire team is made up of former veterinary practice managers who truly understand the ins and outs of your business. So when you ask them a question like, where does my NextGuard Plus rebates go? Not only do they understand the question, but they also know the correct answer. So there's none of that explaining back and forth. Today's session is going to be a fast-paced overview of key financial metrics led by our in-house experts, Melissa, Renee, and Jennifer, who you'll meet in a bit. Feel free to drop your questions into the chat as we go, and we'll tackle as many as we can at the end. And let's get started.
So thank you, Megan. On today's agenda, we are going to cover the AHA chart of accounts revenue centers, explaining how we break down the revenue reports, going over cost of goods sold and touching base on how we can reduce those, and managing labor costs. So what is the importance of the AHA chart of accounts? This is not about us being nosy or requesting multiple reports for absolutely no reason, but to better organize your finances and collect valuable data to strengthen your operation. By using the AHA chart of accounts, we are utilizing a consistent set of codes so that practices can accurately compare their financial data with others to the industry. By standardizing and using consistent set of codes, this gives us a better analysis of practice performance, identifying areas or strengths and potential for improvement. So the AHA chart of accounts also allows veterinarians to easily compare their practice metrics against industry averages, and often you will hear the term benchmarking. Improved reporting also provides valuable insight for practice management and potential investors. So there are a few of the revenue centers that we break out. Each month, we will ask for or pull, if we have access to your PEMs, the category revenue by categories and the monthly totals. So these reports specifically allow us to import your revenue into the AHA chart of accounts. The few that are on this screen are only a fraction of the revenue centers that we can break out. There are 42 subcategories that we can utilize for all kinds of clinics, including large animal, specialty practices, GP, and urgent care. This is an example of what the revenue breakout will look like. This is not the entire page. However, it gives a good visual of how we are breaking down every dollar that comes in. Next on our list is COGS. So place your answer down in the chat. What does the industry consider to be a healthy COGS percentage? Is it A, 35%, B, 15%, C, 20%, or D, 40%? Do you have any answers, Megan? All right, if you answered 20%, you are correct. So the next question that might come up is, how do we get to that ideal COGS percentage? So by utilizing buying groups like VGP, VMG, and PSI, these groups allow you to access significantly lower prices on medical supplies and equipment, simplifying order processes and access to exclusive deals, market and trend insight. Some offer continuing education and marketing services. So you're truly getting multiple services in one group. To utilizing online pharmacy. So we can decrease the quantity of in-house pharmacy by sending home a 2-week supply of meds versus a month for, let's say, the allergy patient or the arthritic patient that we know will be on these long-term, and then submitting a script for them to your online pharmacy and having those delivered to the client's home. Pulling usage reports to see how often the product is moving. So these are extremely useful in seeing how long certain products that you're carrying are sitting on the shelves, which then brings up the question of if I should continue to carry the product, minimize the quantity that you're carrying, or discontinue carrying it completely and move it to your online pharmacy. Reducing redundant medications, so being aware of how many of the same NSAIDs we are carrying or flea medications that are doing the same thing and taking up a large percentage of our COGS. Generic versus name brand medication, so based on doctor preference, but asking yourself, can we switch from carrying Rimadyl and maybe over to Novox? And the same goes for surgical supplies. Can we switch from Ethicon suture to a non-name brand suture and save a few dollars? Utilizing local clinic relationships. I did this when we would need a bottle of potassium. So instead of purchasing the pack of 12 that you would have to purchase and the rest would expire before we could use them, I would call down to one of the local high volume clinics that I made really good friends with, and I would ask to buy a bottle from them. Same goes for certain tests that you have to buy packs of. So like the Pro BNP test, since we didn't run those but maybe once or twice a year, those would also expire and you also have to buy those in packs. So we would call down and purchase one of those. So now I will turn it over to Renee on our team, who will explain why allowing us access to your vendor portals plays a huge role in how we categorize your COGS transactions and the AHA chart of accounts.
Thank you, Melissa. So accessing your vendor portals allows us to pull all of your invoices and break out areas of spending further than what you would see on just one line item. So instead of seeing MWI $6,000 and having no idea what's going into that, we'll break them out into the individual COGS categories that mirror your revenue categories. The charges could have included white goods, vaccines, and pharmacy items, but we won't know unless we break those all out, and we need access to the invoices to be able to do so. This also allows us to cash asset charges, such as medical equipment that would have been missed and may have been miscategorized into your COGS. Your assets should belong on your balance sheet versus your profit and loss, and incorrectly categorized assets will artificially drive up your COGS values. Looking at our cost versus revenue for individual categories allows us to hone in on areas that need attention. Are we paying too much? Did we get double charged? Did we miss a price increase? Are we not paying attention to order quantities that result in large shipping charges? Are we not marking up enough? Excuse me. Are we marking up too much? Are we pricing ourselves out of the market? GL coding helps us to determine these categories, and by reaching out to your vendors, you can have them added to your invoices. We also track labor charges in our AHA charted accounts. Keep in mind that labor costs include wages, taxes, and benefits. We break these out into multiple areas so that we can see where our payroll is going, determine areas of understaffing, overstaffing, overtime, or departmental trends. We can determine where we lack efficiency, and we can see that if we have constant overtime, we need to figure out why. This is an example of how we break it down. It's what we call the 7,000 series, and these are all of your wage expenses and benefits. And you can see it's broken down by type of paycheck issued. So owner veterinarian is different than associate. Office manager is different than kennel assistant. And especially if you're in an AHA accredited practice, there are specific rules about titles for technicians, and these all take that into account. Understaffing and overstaffing can cause areas of concern. If we are overstaffed, we're losing money. If we are understaffed, we end up with burnt out staff members, mistakes are made, and there's a poor culture. Ratios that you find online may or may not be helpful. Determining what the needs, capabilities, and capacities specific to your hospital will determine what ratios work for you. Each practice is unique. We have another question. Please put in the chat, what is the ideal percentage to spend on labor, including doctors? And this also includes your benefit expense. If you answered B, 40%, you are correct.
Yeah, they're just kind of going over the chart of accounts. But
Go ahead.
chart of accounts. Okay.
So what can we do
Great.
when looking at our labor to increase our efficiencies? And the next slide. Ways to improve our employee expenses. Utilizing your tech time, leveraging your technicians and your support staff. We want to set our DVMs up for success, and your doctor should not be your highest paid technician. Why waste a doctor's time on non-doctor tasks? We can look at areas where we can increase efficiencies in appointment flow, hospitalized patients, and administrative tasks. Leveraging your technicians is key. Being busy and having a full appointment schedule aren't reliable indicators of financial success. We hear quite often, we're so busy, why aren't we making the revenue that I feel we should be? Missed charges can also account for a drastic drop in revenue, and these can come on the tail end of burnt out staff making mistakes. It's estimated that the average practice misses 5 to 10% of all charges. This means that a $1 million a year practice could be leaving $100K on the table. Remember to charge for your tech appointments. Tech appointments can fill a great revenue gap. They can be used for wellness blood work, boosters if the pet is well, BG checks, fecal samples, urine samples, ear swabs, allergy injections, laser therapy sessions, and for fear-free and low-stress handling practices, utilize tech appointments for happy visits. Stress the importance of technicians or assistants taking a detailed history before a doctor enters the exam room. ADR is not acceptable, and it will consume more of the doctor's time. There is no need to take a history twice. When you're looking at efficiencies, start with a realistic assessment of your practice and how it compares to others in your area and nationally. This is where the benchmarks come in that we were talking about. They're useful to assess the health of your practice. Physically walk through the steps of your most common appointment types and note the challenges and bottlenecks. Are there communication barriers between team members on the case? Is there a lack of procedures to follow and everyone kind of does it their own way? And I cannot stress enough, ask for and consider staff input when identifying necessary changes to workflows, rules, or processes. They're doing the job every day, and they're key in identifying inefficiencies. Make your PIM system work for you. Automate tasks whenever possible. Well-written templates can make all the difference in not only collecting a complete patient history, but also in time management throughout the appointment. Integrate your lab systems into your PIMs. Utilize scripts to send emails to patients instead of emailing from scratch every single time. Send the emails from your PIN system whenever possible and not an email outside of the system to ensure the conversations are documented, but also ensure the correct and consistent information is being relayed to the client. Utilize options for client to fill out forms and sign documents ahead of time or on a tablet to minimize the need for scanning and emailing documents. Integrate your point of sale systems to avoid errors and save time in the checkout process. Utilizing group codes and bundle codes help to avoid missed charges. To summarize what we've covered today, understanding and organizing finances through tools like the AHA chart helps strengthen operations, reduce costs, and make informed decisions about revenue, COGS, and labor. Reducing COGS involves leveraging buying groups, usage reports, and local clinic partnerships, while effective vendor portal access ensures accurate financial reporting. We can optimize our labor efficiency by leveraging our support staff for appropriate tasks, managing our scheduling appropriately, and keeping a finger on the pulse of your labor expenses. A positive culture of your practice increases productivity and efficiency and enhances job satisfaction, and also allows doctors to focus on higher level tasks. Now I'd like to introduce the newest member of our bookkeeping team, Jennifer Lang. Jennifer was a practice administrator that did end-to-end business management for private general practice, as well as helping an emergency and specialty hospital open from the ground up. She has 16 years of veterinary management and wanted to offer her perspective on joining our team with a private practice background.
Hello, everybody. Happy to be here. Thank you, Renee, for that awesome introduction. I just wanted to shed some light coming from a practice where I was the administrator and I was doing the actual bookkeeping for the practice. However, I had to kind of piecemeal the AHA chart of accounts because we were not using a veterinary specific CPA, which means I was trying to utilize QuickBooks Online to pull my expenses from, but then comparing that with the information from our PIM system for our income. Our end goal really with our bookkeeping was to get it ready for our CPA so they could do taxes. But at the end of the day, my practice owner and I are left sitting there, well, like, how did we do? Do we get a touch base? No, we don't, because our main goal was just getting our taxes done. So for me, being able to get into a role where we can actually learn more bookkeeping in depth and get into that chart of accounts and actually utilize our QuickBooks in order to put all that information in one place. So we're not just focusing on, yay, you know, we made it to the end of the year, we got our taxes done. It also caused me, because I was a manual entry bookkeeper, to spend hours a week. So about 20 hours a week went into my bookkeeping and trying to pull my numbers. And I feel like I could have really utilized that time in order to spend more time on team development, spend more time on looking into our processes. Where can we be more efficient? Just as a vet manager, you know, we're always wearing different hats. So where do we put those efforts? So I think that the perspective that I've gained is with the AHA chart of accounts, as daunting as it sounds, that information really can help us break down our expenses versus our income, and then create goals for our KPIs, making sure that we're continuing to stay not only within industry standards, but to make sure the health of our practice is aligned. Because I feel like as a manager that handled 2 private practices, that's where I was flying blind. Like, I don't have information just given to me where, like, okay, these are our KPIs, these are the goals that we want to hit. We have to set those, but where do we get that information? So I just wanted to shed some light, like, even just newly joining Granite Peak, I can see the value in this type of bookkeeping, whether you're doing it yourself or your practice is utilizing a bookkeeper. So hopefully that helped, and I'm happy to share that knowledge with everybody, and I'm going to hand it back over to Renee.
Thank you. Does anybody have any questions? I saw some pop up in the chat, but they disappeared on me. But it looked like, Megan, you had responded that we'd be putting together some numbers to send out regarding urgent cares and specialty emergency.
Correct. I don't know those offhand. I'm not sure if you do. I don't want to give out false parameters and then have everyone feel like they're under or overwhelmed.
I think, yes, let us put together some of those numbers. There are benchmarks. They do have differences depending on type of practice. A couple of things for labor in an urgent care setting or emergency specialty. One of the things that has become really huge in generating some of that revenue is really heavily leveraging your social media presence. If you have a lull and you post, hey, if you've been waiting to get an appointment, we have a 5-minute wait time when normally your wait time is 45 minutes. That will help to start bring people in. Getting your face out there in neighborhood groups and things like that is huge into building that following. Social media has become such an amazing tool in getting patients into the building. If you have the opposite problem and you have too many patients coming in for your capacity, that's when you want to start looking at what your efficiencies are. Even something as simple as you have to move things out of the way or walk to a different part of the building to complete your lab exams can really slow down your appointment time. So that's when I would start looking at appointment time, types of appointments, because you do have much less control over your schedule in those environments than you do in a general practice.
Does anyone have any questions? It's a free for all, y'all. If you want to, Melissa, if you want to share the next slide, this is our bookkeeping team. So when you do have a question, because I know we'll all think about this and mull over it and then be like, oh, why didn't I ask that? Here's everybody's contact information so we can get back in touch with them.
I would just add 2 things there, because I think in the current market that we're in, while benchmarking KPIs have always been important, but even more critical in 2025 and beyond with the trends that we're seeing, where we're not seeing the revenue growth, you know, of course, as that we did see in the years past, we are seeing a little bit more margin erosion, right? Our people cost, ideally, we want to be at 40. Consistently, we're having conversations at 42, 43%. So where is that profitability going to go? The focus has to be on the financial statements, getting good, reliable data, timely. Because if you're making decisions you know, quarterly or every F year, you're already a little bit behind the 8 ball. So that I think is of top focus. And then also with any KPIs and benchmarks that we ever share or publish, always use those as guardrails, not absolutes. So you got to take into account where you are within your business life cycle. If you're a startup and people cost is at 50%, that could be okay. That could be okay because you're growing, you're building a team, you're growing into the revenue. So again, knowing where we want to get to is critical. And if we're not there yet, having the resources around you to make sure you guide you there and get you there. I think those are the two other big, you know, key focuses for 2025 and beyond.
And definitely, if you have these questions and you're part of our bookkeeping team already, then by all means, ask these ladies because they know what they're talking about. I am also available for questions, comments, concerns, all things operations when things go well or not so well. We're here to help. So definitely great for bringing that up, Jared. There's no questions. As you can tell, right, Melissa, Renee, Jennifer absolutely know their stuff. We hope today gave you just an inkling, a crumb of the valuable insight, something that you can take back to your practice, put into use. CE is pending for this, so if you need a CE certificate, just shoot us an email at events@granitepeakcpa.com, and as soon as that gets approved by the race board, we will go ahead and send those out to you. Don't forget to mark your calendars. Our next webinar is March 7th. We're going to be talking about veterinary specific recommended insurances with Bill Butler. I know this doesn't sound very exciting, but Bill is dynamic and he is passionate about insurance and he knows things that we will never know. So he's a great resource to have in your corner. Definitely something that we should all be paying attention to. I will say, if you guys are not in our Facebook group, I need you to be. Please, now is the time to join. We've marketed it as a safe, supportive space. It's only Granite Peak clients right now. We are there to share knowledge, ask questions, explore best practices with our fellow veterinary professionals. We're not going to be snarky. It's going to be professional. It's hopefully a little bit different than other Facebook groups out there, just so that we can provide you the tools to grow and thrive. So we're going to leave this QR code up so that you have access to it. And Jared is going to share some exciting news about a new service coming soon.
Yeah, two things, and just to follow up on Bill Butler joining the webinar series here next month. I think the benefit of the advisors that we bring to the table and services that we don't provide is these are trusted individuals. They are not there to oversell you. They're going to give you what your practice truly needs at a very fair and affordable price, and they're going to be with you along the way as you continue to grow. So, like Megan said, Bill is top notch. He knows insurance of all different types of plans and policies. And we're excited for him. We're excited for the rest of the presenters here. I'll share my announcement, but then Megan, maybe just jump back before we jump off. I've seen a couple questions pop up. I think one of our core values within the firm, consistent and persistent pursuit of growth and advancement. Whenever we identify pain points within the industry, we want to make sure we can bring and deliver more value. So set to launch in Q3 will be Granite Peak Vet Pay. Too often we find practice owners struggling with the payroll processing and everything that goes into it. We wanted to ensure we're leveraging technology, but at the same time, keeping the human touch front and center. And again, in my experience, payroll has been too focused on kind of outsourcing technology and doesn't truly help you get where you need. And, you know, with that, I think it's going to also allow us to capture even greater metrics as it relates to people cost to better serve and better advise. So Q3, we're going to do a soft launch only for current Granite clients and then go to market with that in 2026. So very, very excited. We'll send more information as it becomes available for Granite Peak Vet Pay.
Yay, I know somebody's excited about that. A couple questions that we can take offline, but Jason asked if we are going to provide a copy of the transcript. We won't provide a copy of the transcript, but we will have this recording posted to our YouTube channel. And when that goes up live, we will send you a reminder that it's there to reference back to. Are there any other questions? Okay, I'm excited you guys were here. Short and sweet today. Next month, probably not so much. It'll be great too. So thank you all for joining. Hope to see you on the Facebook page. We're here when you need us. Bye, guys.